Yeah, good morning, doctors. All right, people. So let's take up the past 3 years NEET question and we, revise what is what, people. So, yeah, as we used to do, try to focus on the content. And once the session is over, I'll share the PDF with you. So the company will be having this PDF, so you can get it from them, or please do text me, WhatsApp me, I'll share the PDF. So more than the PDF, please do focus on the content, guys. So let's quickly revise past 3 years of NEET questions and the concepts associated with that. Yeah. So first, let's take up 2023 and 2022 NEET papers. This is our first question. The transport system, excuse me. Yeah. The transport system across the cell membrane given below indicates what kind of transport? A, simple diffusion, B, facilitated, C, secondary active, D, primary active. All right. First thing first, look at the picture. We have a phospholipid bilayer. So this is one leaflet and this is another leaflet. All right. Across these two leaflets, we could able to see a molecule, and this molecule is getting transported. The most important point you have to observe, you got to look for in this picture is it's a bidirectional transport. This transport is happening in a bidirectional manner. One point. You see a protein or you see a structure which is carrying the transport of, which is carrying out the transport of molecule. And this transport happens in both the directions, inward as well as outward. Obviously, this is going to be a channel. All right. They themselves have named it. This is a channel. And you guys know wherever a channel is getting involved, this is a facilitated diffusion. All right. The word channel specifically indicates facilitated diffusion, people. If the same question gets asked in a different manner, how you should get yourself ready for the variations in the same question? Of course, if it is going to be a facilitated diffusion, if it is a facilitated diffusion, you can look for a few of these points. Number one, it is going to be a passive transport. It is going to be a passive transport, which means there will be movement of molecules from high concentration to low concentration. So you can clearly see molecules which will be distributed on high quantity on one side, less quantity on other side. Number two, there will always be a protein involved. And this protein, which is involved in transport of molecules from high to low concentration, is what is called as channels. And that's going to be your most important clue. Point number three, since it is a channel, there will always be a bidirectional transport. Bidirectional if the channels are leaky channels. If the channels are leaky channels, all right? Provided if the channels are gated channels, there will be unidirectional transport. So only from one side only. And unidirectional transport is possible for a gated channels, guys. And in this picture, we are seeing a channel without a gate, isn't it? There is neither a gate on the one side of membrane, there is nor a gate on the other side of membrane. There is no gate closing this channel. As a consequence, this channel is going to be involved in bidirectional transport. So everything favors option B. So the right answer for this question is going to be B, facilitated diffusion. Few other points regarding other options. If it is a simple diffusion, you can clearly see the red color molecule. This red color molecule, you can clearly see they are located on one side of the membrane. They simply pass through the membrane and they come to the other side. So this red color membrane, this red color molecule represents simple diffusion. The difference between simple and facilitated diffusion is this. Simple diffusion carries transport of molecules without any channels. There is no need of any specialized proteins. There is no need of any specialized proteins. In a precise manner, there is no need of any channels. And the molecules that are getting transported by simple diffusion are very small in size, number one. Number two, these molecules will be non-charged. They are neither positive charged, they are nor negative charged. They are very, very small molecules as well as non-charged molecules. On the other side, facilitated diffusion transports molecules which are big in size, big sized molecules, as well as they will usually be charged molecules. So huge molecules, all right, like glucose or something, and charged molecules like sodium atom, potassium atom, these kinds of charged molecules will be transported by facilitated. And obviously, active transport, be it primary or secondary, they require presence of adenosine triphosphate. If it is a primary active molecule, if it is a secondary active transport, they will be dependent on primary active transport. So you can easily recognize the method of primary or secondary active transport based on the direction of transport. If the molecules are moving from low to high concentration, they are active transport. If they use a ATP to transport that molecule, it will be primary active. If this transport is dependent on an already existing primary active, that's going to be secondary active, guys. So that's the way you're going to handle this question. Right answer for this question is going to be B, facilitated diffusion. All right, simple question. Yeah. Now this is something, kind of deeply conceptual one, and you must have a clear understanding of the way nephron handles certain particular substance and the holistic idea of the word clearance as well. All right, people. Okay. Now this question is kind of a controversial one. We are not sure what graph has been asked in the exam very precisely. Some of our students says the graph was looking like this. The same question, some of our students says the graph was looking like this, right? So, different people comes up with different kinds of graphs. So anyway, it's better we address both the graphs to be on the safer side, people, right? So let us take up the first question and we'll learn this and then we'll move on to the variation of the first question. Here, the question says clearance of a substance X, Y, and Z are studied at different concentrations in the blood. Which of the following is correctly matched? All right. So there are multiple substances W, X, Y, and Z. All right. On the x-axis, they say plasma concentration. The y-axis represents clearance of the substance. And they have given few substances among which we got to pick which substance indicates the graph Y, graph W, graph X, and graph Z. All right. Now, let us study the clearance of a substances before we go into that, let us understand what clearance is. People, time and again, many times we have discussed this point. When you speak about clearance, it simply represents volume of blood which is getting cleared of a substance. Volume of blood which is getting cleared of a substance, which means if I add a substance X, or let me make it simple, if I add X amount of glucose into my patient's body, and I'm going to wait. All right, I'm going to wait till the glucose gets eliminated from my patient's blood. So I'm adding glucose to my patient's blood, and I'm going to wait for some X amount of time, and I'm going to measure in that X amount of time how much of my patient's blood is getting free from the glucose that I have added, which means how much of the blood is getting purified out of the glucose. The glucose can get metabolized by liver, the glucose can get metabolized by muscle, whatever it is. I need that glucose to go out of my patient's blood. So what is the volume of blood which is free from the added glucose is what is called as clearance of glucose. So clearance of a particular substance practically indicates the volume of blood which is free from that particular substance, doctors. All right, good. Now that is what we are studying in y-axis. So in the y-axis, we see clearance of a substance is going to be 100 or close to 100 ml, close to 200 ml, and close to 600 ml. These are all clearance values. On the y-axis, it is going to be plasma concentration. All right. Now let us take up the molecule Y. Let us take up the molecule Y. This molecule Y has got a tremendous amount of clearance. All right. It has got very, very, very high clearance. Very high clearance, which means they get eliminated from blood through the kidney, which means this substance gets filtered in the glomerular capillaries. They're also getting secreted from the peritubular capillaries as well, which is why the amount of blood which is getting purified of the substance is very high. Reason? The substance leaves the blood during glomerular filtration. The substance leaves the blood during tubular secretion. Since this substance is leaving the blood in a huge quantity, much of the blood is getting purified of the substance, and hence clearance of the substance is very, very high. People, I hope you could able to understand the essence and gist behind this clearance. All right. So substance Y has got very high amount of clearance, which means there is going to be glomerular filtration. There is going to be glomerular filtration plus tubular secretion. Tubular secretion, people. All right. Now, what you need to know here is, if a substance is getting secreted from the tubules, proximal tubule, loop of Henle, distal tubule, it's a substance that gets secreted, isn't it? So every secretion happens through a transporter. This secretion happens through a transporter, right? So there is going to be a transporter which is going to secrete the substance from the blood into the nephronic lumen. And every time we use a transporter, you guys know always very well. And every transporter, if it is involved in a picture, they will have something called as transport maximum, which is called as Tmax. All right. We have studied this in facilitated diffusion. If you could able to remember something called the Michaelis-Menten kinetics, which means every transporter has got a maximum limit with which they could able to transport. And we colloquially call this as saturation. So if the numbers of transporters have reached a maximum, say for example, there is a particular number of ENaC, there is a particular number of GLUT transporters. When the number of transporters and the capability of transporting the substance has reached to its maximum peak, there cannot be any further transport happening. All right, because the transporters are getting saturated. So if you look at the substance Y, when the plasma concentration of the substance Y is very less, you could able to see a huge amount of clearance, because every molecule is getting, filtered in the Bowman's capsule. Every molecule is getting secreted in the nephronic segments. As the plasma concentration keeps rising, not good amount of blood is getting cleared of the substance. All right. There is going to be an abrupt drop in the clearance, because there is going to be saturation of the transporters. Because the transporters are getting saturated, the clearance falls. Doctors, please, please, please remember, every time there is going to be an increase in plasma concentration, there is going to be an abrupt drop in clearance. So not much of the substance is going to get out of the blood, because the transporters are getting saturated. At one point, there is going to be a drop in saturation, and remaining of the substances are going to get stuck within the blood itself. So you're going to find an abrupt drop in clearance of the substance from the blood, and the blood is going to stagnate with that substance. What molecule behave this way? When the concentration is going to be very less, there is going to be huge amount of clearance, and with the rise in concentration, there is going to be an abrupt drop in clearance. What kind of substance behave this way? A substance that is getting filtered in the Bowman's capsule, a substance that is also getting secreted out of the blood peritubular capillaries, and this secretion reaches a maximum because of saturation. The substance that behaves in this manner is going to be nothing but para-aminohippuric acid. There's nothing but para-aminohippuric acid, guys. So this substance Y represents para-aminohippuric acid. So let's take up Y as para-aminohippuric acid, and let's look for the option. Which option represents para-aminohippuric acid? Y para-aminohippuric acid, that is option D. So let us check whether Y is para-aminohippuric acid in any other substance, any other options. Not A, not B, not C. So obviously D is the right answer for this question. All right, let us now fix the answers. We just identified the answer. Let us also move on to see how does the clearance curve for X works, Z works, and why X is inulin and why Z is glucose. Now people, you can clearly see the curve W and the curve X resembles exactly one and the same, except for a very slight difference. Except for a very slight difference, the curve W and X resembles just exactly identical, right? It's a straight line. It's a very, very single straight line. And what does this tells you people? You don't have to worry about the plasma concentration. You can keep adding the substance in the blood to any significant quantity. It doesn't matter at all. The amount of substance that gets filtered in the Bowman's capsule and the amount of blood which is getting cleared of the substance is going to be fixed. All right. You may add any amount of substance, people, and you could be able to get a fixed amount of blood which is getting cleared of the substance. What does this tells you? Even though you are keep on adding, all right, this substance is getting freely filtered. This substance is getting freely filtered in glomerulus. Number one. Number two, as they get filtered in the glomerulus, they are neither secreted in the peritubular capillaries nor reabsorbed in the peritubular capillaries. So this substance has got no secretion. This substance has got no reabsorption. No secretion, no reabsorption. And the most important point you have to remember is this word, freely filtered, which means as this substance keeps getting added to blood and as the blood goes to the glomerular capillary for filtration, the amount of substance is going to be filtered in the Bowman's capsule is going to be based on the concentration of the substance in the blood. All right. Let me give you a very simple example, people. Imagine. All right. I'm adding a substance. For example, I'm adding a substance which is having a steady state concentration in my patient's blood. What is steady state concentration? Creatinine is a substance that exhibits steady state concentration, which means if I take my creatinine level by, for example, 3 p.m. in the afternoon, if I take a creatinine level by 6 p.m. in the evening, if I take my creatinine level by 10 p.m. in the night, my creatinine level is going to be absolutely the same because the metabolism with which creatinine gets produced is going to be very, very, very steady. So my blood will have something called a steady state concentration of the drug creatinine. So there is a metabolism going on. Muscle metabolism will yield to the synthesis and manufacturing of creatinine from phosphocreatine and pure creatine. So creatine gets metabolized to form creatinine, and this metabolism happens in such a way that my levels of creatinine in my blood is going to remain fixed at steady state. All right. Now, if the metabolism increases, say for example, I go for severe amount of exercise, all right, now there is going to be huge amount of muscle metabolism breakdown. So my plasma creatinine concentration keeps increasing. So as and when the plasma concentration of creatinine increasing, this creatinine level keeps getting added in the blood. So I will expect this elimination of creatinine from the blood. Now, for example, if my body is eliminating creatinine only through glomerular filtration, there is no hepatic metabolism, there is no elimination of creatinine from my sweat, there is no elimination of creatinine through feces, there is no elimination of creatinine through my breath, nothing. This creatinine gets eliminated only through kidneys and nephrons, and especially this elimination takes place by glomerular filtration alone. There is no secretion, there is no reabsorption. So it is just pure and pure filtration alone, guys. So what does this tells you? How much of blood goes to Bowman's capsule for filtration? That blood is going to get purified out of creatinine and nothing else. So if my, nephron, all the nephrons receives 125 ml of blood per minute, only the amount of creatinine present in that 125 ml is going to be cleared of the blood and nothing else. So it doesn't matter. Whatever the concentration that I see in my blood, it doesn't matter at all. There is going to be a fixed amount of blood that is getting purified out of the substance. All right. Every minute, only 125 ml of blood is getting purified of creatinine. All right, people. So this tells you there is going to be only one event happening, and that event is going to be glomerular filtration alone. That is going to be glomerular filtration alone, isn't it, doctors? So there is neither secretion nor reabsorption. As a consequence, there is only glomerular filtration, and such substance that gets eliminated from blood only through glomerular filtration is going to be 2-1. Number one, it is going to be inulin, and number two, it is going to be creatinine. Inulin as well as creatinine, guys. Now, to be precise, to be very, very, very precise, the clearance of inulin is slightly greater than clearance of creatinine. So if this graph is exactly being asked from the textbook, W has to be representing. W has to be representing inulin because it has got slightly greater clearance value. It has got a slightly greater clearance value than X. So X is going to be representing creatinine. All right, they are more or less one and the same. But incidentally, we don't have any such value, any such question here, which shows W is inulin and X is creatinine. As a consequence, we have to settle for the available option. So we look at X, X resembles inulin or X is inulin. So we settle with this option, guys. So X represents inulin and Y represents para-aminohippuric acid. Now we have learned three substances. Coming to the option and the graph Z. Now, if you look at the graph Z, you compare the plasma concentration and clearance. As the initial concentration of plasma of that substance is increasing, there is no clearance at all, which means none of the substance gets eliminated out of blood. Even though they go to kidneys for filtration, to some extent, as the plasma concentration keeps rising, the clearance is zero, which means every time there is going to be a glomerular filtration, there is going to be parallel reabsorption. Right, doctors? This is very, very, very important and interesting as well. Now, you take up this substance Z. This substance Z is going to get filtered in the glomerulus. So, there is going to be glomerular filtration and there is going to be tubular reabsorption, which means the substance gets back to blood once again. The substance gets back to blood once again, isn't it? So as the substance gets back to the blood level remains the same. So there is no clearance at all. Blood is not getting purified. Blood is not getting cleared. So what happens? Till a particular concentration, there is no clearance at all. Once a particular concentration is reached, what will happen now? There is going to be the same process of saturation. All right. The reabsorption takes place via a transporters, which is nothing but GLUT transporters and SGLT type 2, isn't it? In the proximal tubule. That's for glucose. So this transporter gets saturated, guys. So till a particular value, there is going to be a complete reabsorption. After that, there is going to be saturation, and beyond which blood cannot get purified from the glucose, and glucose keeps on, getting added to the blood itself. You have studied this renal threshold for glucose and Tmax for glucose. The same Tmax plays here as well. So beyond a concentration, somewhat 375 milligram per minute and all, there cannot be any further filtration and reabsorption. So hence there is going to be excretion of the glucose in the urine, and this makes the clearance value keeps getting increasing. So beyond 375 milligram per minute, it is going to get excreted in the urine and the clearance value keeps increasing. There is going to be an increase in clearance value, and this represents substance glucose. All right. So Z represents glucose, guys. All right. And this fits with the option D, and hence option D is the right answer for this question. People, this is a very conceptual question, and I need you to be very clear in the way kidney handles these substances: para-aminohippuric acid, inulin, glucose, and creatinine as well. If there is any doubt in these, substances, please share your doubts. I'll clarify this in even detailed manner if you need before I take you to the next question. If you are clear there, again, please let me know that you are clear so that I'll have a surety that you have actually understood the topic, people. Any doubts in this one question, guys? Of course, this is the toughest of all. Yeah, perfect, doctors. All right, very good. So if you're clear there, I hope you can able to answer the question if the graph is a little bit different. Now, people, let me wait for some time. Now, you try to read the graph and you try to answer this question, people. And there is one subtle difference you got to understand. The same question, clearance of a substance X, Y, and Z are studied at different concentration. Yeah, good, Ajay. And there is two differences. Some of our students say, sir, bicarbonate was given in the option. All right. And some students say, sir, the whole graph was different and the graph was here like this. Now, if you look at the x-axis says percentage of proximal tubule length. So now we are not bothered about distal tubule. We're not bothered about collecting duct, anything. All we are going to focus is on the proximal tubule alone. Whatever that is getting secreted, whatever that is getting reabsorbed in the proximal tubule. And the y-axis says TF by P. Please remember this value TF by P represents concentration of that substance. Concentration of that substance in tissue fluid divided by concentration of that substance in plasma. The same substance, guys. Concentration of that substance in plasma. All right. So we are going to compare this concentration of substances in the plasma as well as in the tissue fluid. Now, you think what is going to be Z, what is going to be Y, and what is going to be X. All right. Okay. So some of you have answered already. Dr. Varsha, it is C. X is going to be glucose, Y is going to be bicarbonate, and Z is going to be para-aminohippuric acid. All right. Can you justify this point, doctors? Or if not others, can you guys give a shot in trying answering this question? And I guess you're right, Varsha. Yeah. But yeah, you're right, Hari. But can you justify this? X, I think, and Y you could able to pull it up. Can you just tell why Z you're considering this the right option? Glucose completely reabsorbed. Very good, Vasha. Very good. Z. Why Z is, para-aminohippuric acid? Can you tell me this one alone? Tubular secretion. Very good, Dr. Muthamal Kumaran. Very good. So why the concentration is, why the whole value, TF by P value is increasing? Why is this so? Freely filtered substance, there is a tubular secretion. Very good, Dr. Giri. More than concentration in the plasma is getting secreted. Absolutely brilliant, guys. Very good, very good, very good, Dr. Vasha. Dr. Giri, absolutely very good. Good. So let us take up X, Y, and Z. If you see X, at the beginning of proximal convoluted tubule, there is going to be equal amount of substance present in tubular fluid and present in plasma, which means they are all freely filtered substance. So whatever the concentration present in the plasma is getting filtered in the ultrafiltrate, and hence there is going to be equal amount of numerator and denominator. So at the beginning of proximal tubule, the ratio is going to be exactly the same, 1:1. All right. As the proximal tubular length is increasing, and if you consider what is happening in the proximal tubule, there is going to be a drop in the fluid substance. All right, which means there is going to be a drop in, there is a small change here. TF refers to tubular fluid, guys. Please make a change here. It is not tissue. It is a tubular fluid. So there is going to be a drop in tubular fluid levels and the plasma concentration rises, which is why the ratio becomes lesser and lesser, right? What makes the ratio to get lesser and lesser? The amount of substance in the plasma is more and the amount of substance in the tubular fluid is less. As a consequence, there is going to be a very less value as a ratio. So obviously you are seeing a substance which is getting reabsorbed back to the blood. What are the substances that gets actively reabsorbed in the proximal tubule? Practically 100% of filtered glucose and filtered amino acid gets reabsorbed, isn't it? So the value or the graph X represents, it can represent glucose as well as, people please remember, this will also be amino acids. In the next exam, you're not going to get glucose as an option because this is already asked. All right. So be ready for amino acids, and doctors, for God's sake, remember this. Both glucose and amino acids gets reabsorbed to 100%. And hence, by the time the end of proximal tubule is considered, the ratio will be close to, close to infinite, slightly more than zero, because the denominator level will be so very high, numerator level will be so very less. All right. So that's the way you have to read this question. So this is going to be glucose as well as amino acids, right? Because the reabsorption rate is going to be 100%. And Y? Y represents a substance that gets reabsorbed close to 100%, and this happens for bicarbonate. The reason? Bicarbonate is reabsorbed to a value of somewhat about 85 to 90% of filtered load. 85 to 90% of filtered load. So obviously X is glucose and Y is bicarbonate. So option C says X glucose and Y bicarbonate. And obviously Z is going to be a substance that is getting consistently filtered. All right. Which means there is going to be a drop in plasma concentration and there is going to be a significant rise in tubular fluid, and hence the ratio becomes more than 1. So obviously Z is going to be para-aminohippuric acid. C is the right answer for this question, people. All right. Absolutely brilliant, guys. You have nailed it. I'm so very happy for you guys. Dr. Varsha, Dr. Giri, Dr. Muthamal Kumar, and absolutely Dr. Hari. Yeah, stunning. So for this question, option is, the right answer is going to be option C, guys. All right. I hope you are clear with the concepts of clearance, how different substances are handled by nephrons, what will happen to concentration of the substance in the plasma, what will happen to concentration of substance in the tubular fluid, what will happen to the ratio, TF by P ratio, as well as what will happen to clearance value. All right. So what happens to clearance of that substance, and what is exactly clearance of a substance, all right, which is volume of blood which is getting purified, which is getting cleared. That can also be referred as volume of blood which is getting purified of the substance. All right. So they both carry a same meaning. Purified of the substance in a particular minute, and this purification happens by nephrons. All right. Two methods. It can get filtered in the Bowman's capsule. It can get, secreted out of peritubular capillaries, people. I hope this question gives you a necessary idea and clarity, people. If you are clear with these topics, almost we have done, guys, because all the questions are something that you're already familiar with. Yeah. The next question. In a 35-year-old patient, due to intravascular hemolysis, serum potassium is increased to 5.5 milliequivalents per liter. So obviously this question tells you that this patient has developed hyperkalemia. All right. Now what will happen to resting membrane potential in this patient? It's obvious. If you consider a cell and potassium, you can obviously recognize that potassium is moving out of the cell by leaky potassium channels, isn't it? So potassium usually goes out of the cell because of concentration gradient. 150 milliequivalents per liter of potassium inside the cell, 3.5 to 5.3 milliequivalents of potassium outside the cell, isn't it? So the huge amount of concentration gradient makes the potassium to leak out of the cell. As and when potassium keeps leaking out, the cytoplasm becomes negative. So the negative charge in the cytoplasm of the cell attracts potassium back, and this makes potassium to come back into the cell, and this is because of electrical gradient. So on one side, concentration gradient drives the potassium out of the cell. On other side, electrical gradient pulls potassium back into the cell. So based on these two different forces, potassium goes out or potassium comes in. Now, every time there is going to be a rise in potassium value outside the cell. So as this value has reached 5.5 milliequivalents per liter, this has practically reduced concentration gradient. Right? When the concentration gradient is reduced, the amount of potassium leaking out of the cell is going to be decreased. There is going to be very less amount of potassium that is going to leak out of the cell. Because the leak has been reduced, you're going to see accumulation of potassium inside the cell itself. So more amount of potassium practically gets stagnated into the cell. So what will happen, guys? Intracellular voltage becomes more positive. ICF voltage keeps getting more and more positive. Right? It's very, very, very obvious. Right? So more positive is the right answer for this question. It cannot be more negative. Absolutely impossible. All right. When it will become more negative can be associated with hypokalemia. When ECF potassium is less, more amount of potassium will leak out of the cell. All right, people. So hypokalemia is possible, with more negative membrane potential. All right. And remains unchanged is impossible. This has to be changed because RMP is determined by potassium. That's another entrance question, guys. Resting membrane potential of every cell is determined by potassium. As a consequence, if there happens to be a change in potassium level, there happens to be a change in resting membrane potential. So every time there is a change in potassium level, RMP do change. It cannot remain unchanged, guys. All right. So option C is also ruled out and 0 cannot happen. All right. So if the potential has increased to a very high value, of course, this is possible. From minus 70, for example, when we speak about more positive, this can be 0 as well, and this can be plus 40 as well. It can be minus 40 as well. Anything is possible, which means 0 is also possible. I'm not denying that. But can this be a right answer? No. You cannot exactly say it is 0, isn't it? As a consequence, we pick more positive as the right answer for this question, guys. All right. So hence, A is the right answer for this question. All right. Okay. Any doubts here? If resting membrane potential becomes depolarized, was another option. Will that be answer, sir? Yeah, absolutely. If you find depolarization as an option, go for it. All right. But let me give you one simple change. You see more positive and you see depolarized. Which one would you pick? The same question is saying, for example, instead of more negative, we'll put it this way. There is an option like this, and this option says that there is a depolarization. Right? Consider more negative is not given, and instead of that, you're finding another option which is going to be depolarization. Now, which one can be picked? More positive, depolarization. Still, more positive is the right answer because what is depolarization? If the RMP is minus 70, and what is the threshold? The threshold is going to be minus 55. Once minus 55 is reached, only then you are going to get something called as depolarization, and the potential will reach all the way up to plus 40 millivolt. From minus 70 to minus 55, this movement is going to be called as local potential. This movement is local potential. So when we say more positive cell potential, local potential is also going to be more positive. Depolarization is also going to be positive, but we cannot be 100% sure in hyperkalemia at a value of 5.5 milliequivalents, there will be a local potential or there will be a depolarization. This is something we cannot be sure about. So there is a question mark. This can be local potential. This can be depolarization as well, but definitely it is going to be more positive. So if you have multiple options like this, you have an option called more positive, you have an option called the depolarization, you have an option called the 0. Whatever the option is, which one will you pick, doctor? Can you now answer me? Absolutely good. More positive is the right answer. So yeah, doctors, I hope now you understood the question very clearly. Very good. So more positive is the right answer. You got to pick. That's the best answer. All right. And yeah, very good, Dr. Monopriya. And in case if you don't find more positive as an option, you go for the other best option. That's going to be, depolarization, because depolarization is above minus 55, minus 50, minus 40, minus 30, minus 20, minus 10, minus 5, they're all depolarization, and then 0. All right. So in case you don't find more positive as an option, but you have depolarization and 0, you go for depolarization first, and then only go for 0 potential, because you can't be very, very sure. All right. So that's the way you got to answer this question, guys. All right. So yeah, guys, super. You did well. Good. So I hope you have the necessary, you know, uh, clarity for answering this question. Good. So that's one thing. And the next question, this is more of an anatomy question, guys. If a dorsal column is hit from the lateral side, which of the following fibers would be affected first? Dorsal column that carries touch, that carries vibration, that carries proprioception. If it is affected from the lateral side, which of the following fibers would be affected? Cervical, sacral, thoracic, lumbar. If you observe the spinal cord, yeah, perfect, Dr. Ajay, very good. If you look at the spinal cord dorsal column, you can obviously see the cervical fibers are arranged very, very laterally, followed by thoracic fibers, followed by lumbar fibers, followed by sacral fibers. So fibers that carries touch, vibration, and proprioception from the lowermost part of the body are arranged very medially, and as the spinal cord goes towards the cervical side, the fibers from the other body structures, from the lumbar innervated regions, from the thoracic innervated region, from the cervical innervated region, they are located on the lateral side, guys. So obviously for this question, option A, cervical fibers are going to be the first structures that gets affected if the dorsal column is hit from the lateral side. Good, straightforward question, not much of a concept even. The next one. Action potential is recorded from a mammalian neuron and marked with a different letter. Which are the following pair is correct? Which of the following pair is correct, guys? Which of the following pair is correct? Now, option or point A. Point A, threshold point. Absolutely not, isn't it? Point A is going to be resting membrane potential. Point B is minus 50. That is going to be threshold potential. Point B is going to be threshold. Point C is going to be the peak of depolarization. Point C is going to be peak of depolarization. And point D is indicating beginning of repolarization. Point D indicates beginning of repolarization. And point E represents, once again, resting membrane potential. Once again, it represents RMP. Option A says point A is threshold. Wrong. Option B says, from point B to point C, this is marked by sodium channel opening. Absolutely, yes. This is depolarization, sodium channel opening. And option C, point D to point E, point D to point E, potassium channel closure. This is wrong, because repolarization is caused by potassium channel opening. So C is also wrong. D, again wrong. Hence B is the right answer, guys. Very good. Many of you have answered this very well. All right. Dr. Hari Prasad, Dr. Shweta, Dr. Ajay. Very good. So B is the right answer for this question. All right. Very good, guys. B is the right answer. More. Okay. So B is the right answer here as well. Good. The same question, but again in a different manner. All right. Point A is threshold. No way. Point A is not a threshold point. And point B, isn't it? Option B, I'm sorry. Option B, which is nothing but point B to E, which means here, from point B all the way to point E, this is going to be potassium channel closure. Never. This is going to be potassium channel opening. All right. And option C, from point B all the way to point D. From point B all the way to point D, this is absolute refractory period. Yes. Yes, guys. This point is going to be absolute refractory period, isn't it? So this is absolute refractory period, and the later point is going to be relative refractory period. So for this question, if the options are interchanged, option C seems to be the right answer. And let us look at option D as well. Point E is going to be absolute refractory period. Wrong. Point E is threshold. So for this question, guys, the right answer for this question is going to be C. Very good, Dr. Giri. Very good, Dr. Hari Prasad. So yeah. So for this question, C is the right answer. Again, people, some of our students said that, sir, they were asking about absolute refractory period. They were not, there was not any option related to sodium channel opening. So we can't bet on, people's, recalling memory, especially out of the exam. So to be on the safer side, I've given you both the kind of questions which students told me this was the way the question was framed. Anyway, whatever the options it is, you have the necessary idea to get the right answer. I believe so. That's good. So yeah, the next question. Spirometer recording was given in the following diagram. The segment marked with arrow. You can clearly see this arrow mark represents two parameters. Number one, the bottom of the table residual volume, and slightly above the residual volume is going to be expiratory reserve. Together, this is going to be functional residual capacity. And the right answer for this question is going to be option B, FRC, guys. Perfect. Very good. It's an easy question. Good, doctors. Very good. And the next one. In case of infant respiratory distress syndrome, there is a deficiency of which lipid? Lecithin, sphingomyelin, phosphatidylserine, phosphatidylethanolamin. Arun, Dr. Monopriya, Hari Prasad, very good, very good. Lecithin. So you guys know there will always be more amount of lecithin and comparatively less amount of sphingomyelin, and this ratio is going to be 2, isn't it? It is going to be 2:1. So this ratio must be greater than 2 to call the surfactant as a normal surfactant. All right. So very good. Lecithin is the right answer for this question. Good. A priming gravida goes to preterm labor at 28 weeks of gestation and delivered a baby. What is true about the newborn lung? Yeah, I think you can able to answer this question, guys. What is true about the newborn lung? Surface tension decreases, complaints increase. All right. B, surface tension increases, complaints decrease. Dr. Satish, Dr. Monopriya, Dr. Vinita. Surface tension increases, complaints decreases. Tension increase, complaints decrease. All right. Very good, guys. Beautiful. It's a preterm labor at 28 weeks. So this itself will be very clear that there is going to be no, or there is going to be extremely less amount of surfactants. So without surfactants, obviously, there is going to be increased surface tension. All right. And because of lack of surfactants and in the presence of air, the lung is going to be, very difficult to inflate as well. And hence the complaints decreases. So option B is the very right answer for this question. Surface tension increases and complaints decreases. Very good, guys. Brilliant. Awesome. I'm happy. Vitamin K dependent clotting factors. Factor 1, 2, 3, and 4. Factor 2. Very good, Dr. Prasanna Kumar. Very good, Dr. Arun. Very good, Dr. Divya. Good. Factor 2. It's going to be factor 2, factor 7, factor 9, and factor 10, isn't it? So 2, 7, 9, 10. All these factors comes out of liver. For liver to synthesize these factors, you require vitamin K, I repeat, in the reduced form. So every time this vitamin K is present in the reduced form, only then it could be enough. It could be able to synthesize factor 2, 7, 9, and 10. All right. But every time a vitamin K is involved in synthesizing 2, 7, 9, 10, this obviously becomes reconverted to oxidized form. So vitamin K in the oxidized form is not good enough to synthesize these clotting factors 2, 7, 9, 10. So in order to have a good synthesis of factor 2, 7, 9, 10, very good. You must have to reduce the vitamin K, and the enzyme which is involved in reducing vitamin K is going to be vitamin K epoxide reductase. vitamin K epoxide reductase, and only because of this enzyme you get vitamin K in the reduced form, and in this reduced form only it is going to be involved in synthesizing factor 2, 7, 9 and 10. And there is a drug that specifically blocks this enzyme vitamin K epoxide reductase, and that is going to be warfarin. And the derivative of warfarin like nicomalone. So administration of warfarin, administration of nicomalone, acetron, it will inhibit vitamin K epoxide reductase. As a consequence, there is going to be decreased synthesis of 2, 7, 9, 10, which is exactly why and how nicomalone and warfarin acts as anticoagulant. All right, nicomalone and warfarin acts as an anticoagulant, guys. Now, people, one more point in this. If you consider factor 7 and based on factor 7, if you look at the pathway with which the clotting mechanism takes place, this is going to be primarily extrinsic pathway or activation pathway. So factor 7 will lead to synthesis of factor 10, and that will lead to synthesis of factor 2. So because of administration of warfarin and nicomalone, there is going to be decreased synthesis of 2, 7 and 10. As a consequence, there will be increase in PT-INR. There will be increase in PT-INR. All right, people, at the same time, just because there is going to be decreased synthesis of factor 9, as a consequence factor 10, as a consequence factor 2, this represents indirect pathway. As a consequence, you will be having an increase in activated partial thromboplastin time as well. All right. So with warfarin administration, with nicomalone administration, or there is going to be, if there is going to be deficiency of vitamin K as well, you will have an increased PT-INR, you will have increased APTT seen in your patients as well, guys. That's vitamin K dependent clotting factors and the necessary points for your exams. All right, good. The next question. Yeah, Ajay, both will be increased, right? PT-INR will be increased, APTT will also be increased, isn't it? Good. And yeah, the next question. The phases of ventricular muscle action potential is given below. Which of the following is correctly matched? Calcium channel open in phase 2. Yes, that's the right answer. Phase 2 is going to be called as plateau phase. Plateau phase. This is the way the graph will be, isn't it? So it's going to be phase 0, phase 1, phase 2, phase 3 and 4. So phase 2 is plateau, and that's calcium channel opening. B, potassium channel closes in phase 2. No, potassium channel is also opens in phase 2. C, transient sodium channel open in phase 3. And when it comes to phase 3, this is transient potassium channel and not sodium channel. And D, calcium channel closes in phase 4. Of course, calcium channel closes, but not during phase 4. But this happens in end of phase 2. And hence the right answer for this question is A. Very good, Dr. Monopriya. Good. A is the right answer for this question. Good. Now, which of the following is true regarding the following diagram? This is a diagram of cystometry or cystometrogram. Cystometrogram, which speaks about the pressure and the volume relationship in the bladder. All right. So it is the relationship between volume and pressure in the bladder. Dr. Shweta, Dr. Giri, you say it B. Segment 2 is manifestation of Laplace law. Sabari, very good, very good. Monopriya, good. So B is the right answer. So here Laplace law says the pressure inside a hollow viscous is directly related to 2 times the wall tension and inversely related to radius. So obviously with the bladder getting expanded, as the smooth muscle relaxes, the pressure is going to remain, decrease. So as the radius increases, the pressure decreases, and that's the way the pressure is kept constant all throughout phase 2. And option B is the right answer for this question. Very good, doctors. Very good. So any doubts in this question, guys? In case if there is anything, please do share your doubts. I'll explain. Yeah. Saturday night palsy is because of. Next question. Saturday night palsy is because of. Type A nerve fibers are more susceptible to pressure. Type C fibers are more susceptible to pressure. B fibers are more susceptible to pressure. B fibers are more susceptible to pressure. A. Very good. So you know this very well. When it comes to pressure induced compression. When it comes to pressure induced compression, all right, it is going to be fiber A that gets damaged more easily than fiber B. more easily than fiber C, isn't it? So A is most susceptible and C is least susceptible. A is more and C is least susceptible, and hence, type A fibers are more susceptible to pressure than type C fibers is the right answer. Of course, type B fibers are also more susceptible to pressure. This also seems to be right answer, isn't it? If you have two right answers given, which one will you pick? Will you pick A or C? Why A? Dr. Hari, Dr. Sabri, Dr. Vinita, Shweta, people, can you tell me why you have picked A as the right answer and not C? Of course, C is also right? B fibers are more susceptible to pressure than C fiber. Why A? Very simple question, but subtle concept. I mean, not a concept, strategy. Large fiber. Okay, Zai, of course, B is also large fiber. Look at this option, guys. Type B nerve fibers are more susceptible to pressure than type C fibers. Isn't this a right answer? Ah, beautiful, Dr. Satyakumar, Dr. Merlin. At B fibers are not motor fibers, all right? It is an autonomic fibers. Thinnest is A. No, Giri, A is the biggest fiber. A is the biggest fiber, all right? So, Dr. Satyakumar and Dr. Merlin, you guys are right. Very, very, very right. Good. The question is asking about Saturday night palsy. So our focus is supposed to be a nerve which is related to motor innervation, which is A fibers. And even though A and C are, option A, option C are valid for this question, still you got to pick one best answer, that is A, because the question is talking about Saturday night palsy, motor fiber and not autonomic fibers. Very good, very good. Dr. Satyakumar and Dr. Merlin, you nailed it. So guys, knowing the right answer is one thing, knowing why something is right and something is, the best answer among the given options is even more important, all right? So that's why we all have to pick A as the right answer for this question, right? Good, good. And yeah, another one. What is the first change seen in body if the temperature set point is increased from A to B? Set point is increased, all right? The set point is increased from 98 or 98.5 all the way to 103. If the setting of the thermostat is increased, what are you seeing here? There is an increase in body temperature, right? Good. There is an increase in body temperature. From A to B, what is happening? There is going to be good. Increase in body temperature. Lovely. So what are all the possibilities with which body temperature can increase? There can be vasoconstriction, there can be chemical thermogenesis, there can be shivering. All the three options can increase body temperature. I repeat, Dr. Shweta, Dr. Vinita, Dr. Hari, Hari Prasad, Hari Ganesh, every three options. Vasoconstriction can increase temperature. Chemical thermogenesis increase temperature. Shivering increase temperature. Which one is the best answer for this question? Is it B, C or D? Okay, for this, the right answer is option B. Dr. Vinita and Dr. SS, you guys are right. Can you guys tell me why you have picked B as right answer? Dr. Vinita and SS, why you picked, first in? Ah, lovely. Very good, Dr. SS. That's the very first event that happens, all right? So the order goes this way. Vasoconstriction is the first step in an attempt to increase body temperature. Very good, Dr. Vinita. Very good. First change. Number one. Chemical thermogenesis, number two. When step number one and step number two fails, only then shivering comes into the picture. So the order of events happens in this way. Vasoconstriction first, chemical thermogenesis next, shivering next, and hence the first effort is vasoconstriction. You got to pick B as the right answer, vasoconstriction, guys. Very good. Good. That's the way you got to answer. All right, people. Please remember, I sincerely request you to put your best attention now. NEET is a exam which will give you multiple right options for a single question. Your job is to pick the best answer, single best answer, not right answer. Please don't impulsively think the answer is right and I'm going to tick this answer and moving to the next question. Don't do that. You have 40 to kind of 50 seconds time for one question. So even though you impulsively think that this is right answer, please analyze all the other options. You make sure whether all the options are analyzed, and among all the options, this seems to be the best answer. All right, guys, this is not a matter of what is right. This is a matter of what is best. All right. So take a step forward and go to a little bit of depth and analyze what is the best answer and then choose your answer, guys. All right. Fine. Fine. Yeah. It's an easy question. The next one, baroreflex is an example of what homeostatic process? Baroreflex, guys. Ah, lovely. It's a negative feedback. Every time there is an increase in mean arterial pressure, every time there is an increase in pulse pressure. And people remember, if the question is asked this way, all right, mean arterial pressure and pulse pressure, please remember, you got to pick pulse pressure as the best answer. So I'll go in the order. The very first change is pulse pressure increase. The second one is mean arterial pressure increase. Increase in pulse pressure and mean arterial pressure is going to kickstart baroreceptors. And the afferences are taken to nucleus tractus solitarius by glossopharyngeal nerve from carotid sinus baroreceptors. Aortic arch baroreceptor sends afferents via vagus. This afference is taken to nucleus tractus solitarius, and that goes and inhibits. Rostral ventrolateral medulla. As a consequence, there will be activation of vagus. And activation of vagus leads to decrease in cardiac activity, and this leads to decreased pulse pressure and decreased mean arterial pressure. So what was an increase now become decreased. So this is a negative feedback mechanism, and hence option B is the right answer for this question, guys. Right? Good. So there was a doubt. If temperature set point is increased, our body response is to cool, then why not it is sweating? Okay. Dr. Tangati, if you look at this image, the temperature set point, please remember the set point. Let me make it simple. The set point determines body temperature. Or in another way, the set point fixes body temperature. All right. Now this set point is nothing but anterior nucleus of hypothalamus. That's the thermoregulatory center. Anterior nucleus of hypothalamus. All right. That's the thermoregulatory center. So if by some mechanism, all right. Okay, Dr. Vinitha, sir, I'm always confused with thermoregulatory mechanism. Like when increases in temperature, it should only lead to sweating and vasodilation. Okay. The same questions, both for Dr. Vinitha and Dr. Tangadi, the doubt is same. All right. Now, please remember. Now, imagine I have an anterior nucleus of hypothalamus, and this anterior nucleus of hypothalamus always tries to keep the temperature in a fixed range of 98.5 degree Fahrenheit. 98.5 degree Fahrenheit. All right. Just because my anterior nucleus says that body has to be in this temperature, the whole mechanism of body will operate in such a way to keep the temperature at 98.5 degree Fahrenheit. If the anterior nucleus says, no, the temperature has to be 103. Now the whole mechanism will operate in such a way that the temperature is elevated to 103 degree Fahrenheit. So what determines body temperature? It is anterior nucleus of hypothalamus. Usually, guys, anterior nucleus of hypothalamus has got a mechanism of action like this. Anterior nucleus tries to cool the body. Anterior nucleus tries to cool the body. And we have another nucleus called the posterior nucleus of hypothalamus, which will be involved in warming the body. And always anterior nucleus of hypothalamus will be inhibiting posterior nucleus of hypothalamus, and the range of this inhibition will be somewhat about, for example, it is 90 7 degree Fahrenheit, 97 degree Fahrenheit, all the way to 98.5 degree Fahrenheit. So across this range, all right, 97 to 98.5 degree Fahrenheit, across this range, anterior nucleus will be suppressing posterior nucleus. As a consequence, body temperature will be in this range. Body temperature, which is represented in red line, will be in this range, guys. Now, if there is going to be any further injury to anterior nucleus, if anterior nucleus gets injured, let me be very specific. If anterior nucleus gets injured, and this injury is essentially caused by interleukins, and this interleukins are primarily going to be interleukin 1, interleukin 6. If these interleukins, because of infection, inflammation, if they damage anterior nucleus, the set point is increased. All right, the set point is increased, which means there is going to be increase in set point. Say, for example, as per this question, the set point is increased to 103 degree Fahrenheit, which means the anterior nucleus will inhibit posterior nucleus, all right, only after 103 degree Fahrenheit. All right, doctors? So understand this. You just learned that anterior nucleus is inhibiting posterior nucleus, and at what point this inhibition is happening? This inhibition is happening, from 97 all the way to 98.5 degree Fahrenheit, right? So when the temperature is 97 or 98.5, anterior nucleus will be inhibiting posterior nucleus. With injury and inflammation in the presence of interleukin 1 and 6, this inhibition is seen not at 98.5 degree Fahrenheit, but at 103 degree Fahrenheit, which means till 103 degree Fahrenheit, anterior nucleus will not inhibit posterior nucleus. So what happens? Posterior nucleus will be activated. If posterior nucleus gets activated, it will start the processes of warming up the body. What are the processes of warming up the body? Vasoconstriction, chemical thermogenesis, shivering. So point B represents, this point represents injury to anterior nucleus because of interleukin 1 and 6. All right, interleukin 1 and 6. This is how fever develops. So what happens with fever? Someone develops an infection or inflammation, and this leads to synthesis of interleukin 1 and 6. Interleukin 1, interleukin 6 affects anterior nucleus of hypothalamus, makes the anterior nucleus to get damaged. As a consequence, the set point is altered. So anterior nucleus will not inhibit posterior nucleus till 103 degree Fahrenheit. By that time, posterior nucleus will be activated and it starts warming the body. So a patient suffering from infection and inflammation will first develop vasoconstriction that will kind of create a chill sensation. All right. Gradually, there is going to be chemical thermogenesis. Body temperature starts rising. If the set point is not reached, patient will go for shivering and the temperature comes to a maximum value. That is exactly how fever comes in. Now, if you interfere this patient with paracetamol, there is going to be a drop in interleukin 1 and interleukin 6. So because there is going to be a drop in interleukin 1 and 6, the set point is abruptly decreased and gradually body temperature also goes down, which means anterior nucleus will start suppressing posterior nucleus at 98.5 degree Fahrenheit itself. And by this time, posterior nucleus will not be working. Anterior nucleus tries to cool the body. There is going to be vasodilatation and there is going to be sweating. That's the whole mechanism, guys. All right, Dr. Vinita and Dr. Tangati, the doubts that you have asked is kind of profound, and I'm sure you could able to now understand the exact operation behind the temperature set point. Yeah, perfect. It's perfect. Very good. So yeah, that's temperature regulation and baroreflex. Easy question. Very good, people. The other questions are quite simple. Which of the following cause a decrease in ECF potassium? Adrenaline, acidosis, insulin, glucagon. Now, decrease in ECF potassium. This question is all about sodium potassium ATPase pump, guys. So let me take up a phospholipid bilayer. So let's take up extracellular fluid here and let's take up intracellular fluid here. We have sodium potassium ATPase. Sodium potassium ATPase. All right. From sodium potassium ATPase perspective, potassium combines with the ECF side of alpha subunit of sodium potassium ATPase, and to the ICF side of sodium potassium ATPase, sodium binds. So if this happens, all right, the potassium will be thrown into the cytoplasm, sodium will be taken out of the cytoplasm. This is sodium potassium ATPase, isn't it? Now, every time if this pump is getting activated, more potassium goes in. Every time this pump is getting activated, more potassium goes into the cell, and this leads to decrease in extracellular fluid potassium. So this is mediated by any kind of factors that activate sodium potassium ATPase. Number one, most important factor is going to be thyroxine. Number two, this is going to be mediated by insulin. Thyroxine, insulin, guys. And number three, to some extent, there is also going to be effect of adrenaline. And number four, aldosterone. Adrenaline as well as aldosterone, guys. All right. So these are all the four factors that influences sodium potassium ATPase. All right. Hence, the best answer for this question is going to be insulin. Insulin is the first best answer, and the second best answer is going to be adrenaline. If you see insulin as well as adrenaline, I sincerely request you guys to go for insulin, people. All right. Number one. And number two, second point, acidosis. Every time there is going to be an acidosis, please remember acidosis inhibits sodium potassium ATPase. As a consequence, because of inhibition of sodium potassium ATPase, potassium will remain within the extracellular fluid itself. And please remember, acidosis will lead to hyperkalemia. Acidosis will lead to hyperkalemia, guys. All right. So that is how insulin is the right answer for this question. Very good, people. Good. And the next one, hemibalismus. Straightforward question, guys. It's because of lesion in which of the following? Caudate nucleus, subthalamic nucleus, substantia nigra, globus pallidus. Ah, perfect. Lovely. The answer is subthalamic nucleus. Good. Caudate nucleus damage leads to Parkinson's. Sorry. Caudate nucleus damage leads to chorea. Huntington's chorea like this. Substantia nigra damage leads to Parkinson's. Globus pallidus damage leads to athetosis. So yeah, subthalamic nucleus is the right answer. Very good, doctors. Very good. Yeah. The next one, cell membrane of a cell is freely permeable to three ions, X, Y, and Z. At RMP, the respective equilibrium potential of X and Y are -30 and -40. What will happen to the membrane potential if a drug is infused which can block the permeability of Z? Any idea, guys? Another tough question, kind of important as well. So yeah, people, answer this question, guys. Okay. See, people, there are three ions, X, Y, and Z. All right. And these three ions are freely permeable. And please remember, resting membrane potential of a cell is determined by freely permeable ions like potassium. All right. It is determined by freely permeable ions only. Or very specifically, resting membrane potential of a cell is determined by Nernst potential. Nernst potential of freely permeable ions. This is a very important question. And guys, for God's sake, please pay close attention. Dr. Akshara Rajendran, A, depolarization, +70, so depolarization. All right. Dr. Akshara, your answer is right, but yeah, Vanitha, your answer is right, but the explanation is a little bit wrong. All right. Anyway, let's learn this properly. Right. So RMP is determined by Nernst potential of freely permeable ions. All right. Now, when it comes to this question, resting membrane potential is calculated using an equation called as Goldman-Hodgkin-Katz equation. All right. Goldman-Hodgkin-Katz equation. simply put up, this is going to be Goldman equation straight away. It's going to be Goldman equation, guys. So how does this equation gets derived? It's a very simple parameter, right? So it's going to be 61.5 divided by valency. Whatever it is a cation or anion, 61.5 divided by valency multiplied by log of concentration of ion X, right? Concentration of ion X outside the cell divided by concentration of ion X inside the cell. Concentration of ion X inside the cell and multiplied by their respective permeability. Permeability of X outside and the very same parameter, permeability of X inside the cell as well. Right? Permeability of X. In a very similar manner, very similar manner, this is going to be concentration of Y, concentration of Z, everything, guys. So it's going to be Y in a very same parameter. So let me just write it as ditto for Y, and this is going to be the very same ditto for Z as well. All right. Now they have given the values. They have given the values itself. So all these parameters, concentration of X outside, permeability, it comes down to minus 30, and the other one, it comes down to the parameter of Y, it comes down to minus 40. So all the values substituted, it becomes X and Y values were given. All right, it is minus 30 for X and minus 40 for Y, isn't it? Now, what is the question asking? What happens to the membrane potentially if a drug is infused that blocks the permeability of Z? Now, the permeability of Z is blocked, which means Z is no more moving. All right, Z is no more moving. What does that tells you? You can clearly see if it is resting membrane potential, guys, if it is RMP, we studied that this is determined by Nernst potential of ions which are freely permeable. Now, Z is blocked. Z is impermeable by this question. The question says the permeability of Z is getting blocked. So we can practically take Z out of the options. We can practically take Z out of the option, guys. It is ruled out. Now you have got just two ions. One is minus 30 and the other one is minus 40. Now every time if a cell membrane potential is considered, all right, when it comes to RMP, doctors, please understand this. This RMP is going to be determined by average of Nernst potential. Average of Nernst potential of available permeable ions. Average of Nernst potential of available permeable ions. In this regard, you got to take up minus 30 and you got to take up minus 40, and that will give you a value of minus 70, and average of these two is going to be minus 35 millivolt, and minus 35 millivolt is going to be depolarization. Is going to be depolarization. All right. So guys, I hope you get the idea for this question. All right. Now, the reason why I'm insisting this question is there was a question in 2016 NEET where you were, you were supposed to find the answer based on the values. You were supposed to find the answer based on values. All right. Minus 35 was one value, 0 was one value, minus 60 or minus 70 is another value, minus 55 is another value. So if the question is asked where you are supposed to pick the answer based on values, what you need to do? You got to consider the average of Nernst potential of available permeable ions and you calculate the value. Dr. Tangati, why minus 35 is depolarization? Now, minus 70 is going to be resting membrane potential. Minus 55 is going to be threshold potential. And every value greater than minus 55 is going to be depolarization, and that's exactly why, since the value is minus 35, which is more positive than, you're right, your minus 55 is less positive, minus 35 is more positive, and hence it is depolarization. All right. So this is exactly the reason why we picked depolarization as the right answer. And guys, are you clear with this explanation? If the question comes to you where you got to calculate the membrane potential, can you able to do this? Is there anything confusing or doubtful in this question, guys? Everybody, please make sure you know this question right and well. What you need to do, please go for average of the Nernst potential of available permeable ions. That is what you're supposed to do. All right, guys, anybody? Any doubts in this question, people? Yeah, all right. So I hope you're getting this message. So please be clear. Two basics you have to be keeping in mind. Number one, resting membrane potential is determined by permeable ions. That's one basic. And the second basic is, when it comes to blockage of one ion, you got to go for average of Nernst potential of other permeable ions. Perfect, guys. Super. Yeah, that is all, guys. Here are all simple, straightforward questions. Which of the following does Golgi tendon organ detect? Simple question. Golgi tendon organ detect tension developed in a muscle. All right, muscle tension is detected by Golgi tendon organ, and very good. Length of the muscle is determined by muscle spindle. Muscle spindle detects the length of muscles. All right, perfect, straightforward question. Which of the following hormone acts on intracellular receptors? Guys, hormones acting on intracellular receptors. Very good, guys. Thyroxine. And please remember, when it comes to intracellular receptors, we got two kinds of receptors. Number one, it is going to be nuclear receptors type 1. To be precise, type 1 receptors or type 1 nuclear receptors are also called as cytoplasmic receptors. Type 1 nuclear receptors are also called as cytoplasmic receptors. And the hormones using cytoplasmic receptors are going to be aldosterone, mineralocorticoid, and glucocorticoid cortisol, and dehydroepiandrosterone. These are all adrenal cortical steroids, followed by gonadal steroids like testosterone, estrogen, and progesterone. So they're all cytoplasmic receptors, also called as type 1 nuclear. In another word, that's going to be type 2 nuclear receptors, which are exactly located within the nucleus itself. So exactly within the nucleus itself. And the hormones using this pathway is going to be triiodotyrosine, tetraiodotyrosine, vitamin A retinoic acid, and vitamin D3 cholecalciferol. All right, perfect, guys. Okay, yeah, perfect, guys, perfect. Shweta, it is not nuclear. Yeah, perfect. Now you got the answer. Very good, guys. So thyroxine is the right answer for this question. Good. And 2021 NEET, guys, just few questions. Easy questions. A child presents with multiple episodes of loose stools managed with ORS. What transporter is involved in handling solutes in ORS fluid? Oh, beautiful. SGLT type 1. Good. SGLT type 1 is present in intestines. Intestinal enterocytes. And you know this very well. SGLT type 2 is present in proximal convoluted tubule cells. And when it comes to intestines, consider this is intestinal lumen. And let's take up a enterocyte here. Enterocyte, you're going to find two kinds of transporters. On the apical membrane, this is going to be sodium dependent glucose transporter type 1. On the basal membrane, it's a GLUT transporter, but this is going to be GLUT2. This is going to be GLUT2, guys. GLUT2. All right. Now, let me just ask you one question. If you have GLUT2 given in this question, which one will be your right answer? Will it be SGLT1 or GLUT2? Will you go for option A or option C? If your question gives you SGLT1 and GLUT2, which one would you pick? Why, Dr. Aces? Yeah, Vinita, Monopriya, why A? Why not C as the answer? Yeah, you're right. Why A? Why not C? Perfect, perfect. Luminal side, absolutely brilliant. Very good. And number one, this consists of solute. The question is asking you about solutes, which means you need to have a transport of sodium as well as glucose. Lovely, lovely. Beautiful, Dr. Chandrakumar. Absolutely stunning. Very good. So it requires transport of both sodium as well as glucose. All right. Whereas GLUT2 will be transporting only glucose. The question is very specifically asking solutes in the ORS, and hence glucose and sodium is being combinedly transported by SGLT type 1, and hence that's the best answer. And the other Dr. SS, you're also very right. All right. The luminal transporter is the one that we got to address. So SGLT1 is the best answer, whatever the question may be. Very good, guys. Lovely. A patient presents with prominent A wave in JVP with mid-diastolic murmur. Possible condition. Mid-diastolic murmur. Yeah, tricuspid stenosis. Very good. Very good. Lovely. Tricuspid stenosis is the right answer. It can never be mitral. It can never be mitral regurgitation because it has got nothing to do with left side. Yeah, perfect, guys. Super. Easy question. That's something we are familiar with. Yeah. The next one. Patient's body fluid composition shows the following values. Sodium 10 milliequivalents. Potassium 150 milliequivalents. Chloride 15 milliequivalents. Will this be plasma or interstitial fluid or ECF or ICF? Ah, very good, Dr. Giri. Dr. Vinita, very good, good. It's a ICF value. Monopriya, all very good. Prasanna Kumar, yes, it's intracellular fluid, guys, because of enormous quantity of potassium. All right, perfect. Yeah. The patient was tachypneic and developed carpopedal spasm. Identify the right statement regarding potential etiology for this presentation. The patient is tachypneic as well as carpopedal spasm, developing carpopedal spasm. All right. Oh, metabolic alkalosis or metabolic acidosis? Arun, Hariprasad, acidosis. Vinita, alkalosis. Okay. Giri, alkalosis. Okay. 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 Guys, it's a simple one. Carpopedal spasm is something because of hypocalcemia. You guys know this. It is hypocalcemia that leads to tetany. And this tetany is the reason behind carpopedal spasm. Chostak sign, Trousseau sign, right? Hypocalcemic tetany is the reason behind carpopedal spasm. So end of the day, this patient is suffering from hypocalcemia. Why is this so? Now, every time there is going to be excess amount of albumin available, if there is too much of albumin available, this albumin will go and combine. Albumin is a negatively charged protein. Albumin will go and combine with a positively charged calcium, and this will be leading to development of hypocalcemia. Now, when there will be excess amount of albumin available, every time there is going to be a decreased amount of hydrogen and another cation, there is less amount of hydrogen available to combine with albumin. So this combination of hydrogen and albumin is going to be less. As a consequence, more and more amount of albumin is readily available to combine with calcium. So every time there is going to be a drop in, hydrogen, the hydrogen albumin combo is not going to work out, and hence albumin will be more and more available, and this available albumin will be combining with calcium, leading to development of hypocalcemia, and that leads to carpopedal spasm. Decreased hydrogen is seen in metabolic alkalosis and not acidosis. So this can be respiratory alkalosis as well, Prasanna. Absolutely right. But do you have respiratory alkalosis as an option in the question? Vanita, not every alkalosis cause fall in electrolytes. This is specifically calcium. Vanita, please remember, alkalosis does not cause hyponatremia. All right. It does not cause hypochloremia. So we can't overgeneralize here, Dr. Vanita. Dr. Prasanna Kumar and Dr. Vinita, I hope both of your doubts are getting addressed. Dr. Vinita, you cannot overgeneralize alkalosis with electrolyte level. This is only two electrolytes, potassium and calcium. All right. So that is the reason why we are not picking, hypochloremia or hyponatremia, nothing in this question. All right. Very good. And Dr. Prasanna Kumar, respiratory alkalosis can also cause carpopedal spasm, but that is not given in the option. All right. So Dr. Aaron, perfect. B is the right answer. Ajay, now you understand why this is the, why B is alkalosis, Ajay? Dr. Jiva, even in blood transfusion, hypocalcemia occurs, alkalosis occurs because of citrate. So whether this concept can be applied, yeah, why not? Why not, Jiva? Very good. This is very right. Hypo in blood transfusion, the citrates gets converted to bicarbonate, leading to alkalosis, and hypocalcemia is a possibility. But that is very, very kind of rare, because the alkalosis that gets developed during blood transfusion will not be that severe enough to cause, hypocalcemia. But hypocalcemia in blood transfusion is more because of the citrate chelating calcium. So, say for example, if we transfuse blood to a patient, and after blood transfusion, if you go and check the pH of patient, will the patient develop alkalosis? No, right? So, Jiva, remember, this happens to a very, very trivial extent. So, the hypocalcemia in blood transfusion is majoritarily because of citrate chelating calcium, and to a practically zero extent because of the alkalosis. You got this, Jiva? Guys, any doubts? Yeah, perfect. Guys, so any doubts in this question? People who has not answered, if respiratory alkalosis compensated by metabolic alkalosis, is this possible? Yeah. If respiratory alkalosis, if it is getting compensated by metabolic acidosis, Arun, the pH will be more or less normal, right? If the pH becomes normalized, there is no need of development of alkalosis, acidosis. There is no, calcium abnormality as well, right? If the alkalosis is compensated, things would have gone back to normal, right, Arun? And Dr. Tangati, respiratory alkalosis, carbon dioxide. Yeah, good. Dr. Arun is clear now. Dr. Tangati, respiratory alkalosis. 1 minute. Respiratory alkalosis due to carbon dioxide washout, does it decrease hydrogen? Yeah. Yes, Dr. Tangati. If there is an alkalosis, there will be a drop in hydrogen. Absolutely. All right, Dr. Divya. And any relation between respiratory acidosis and calcium level? Yeah, Divya, whatever the acidosis it is, if there is too much of hydrogen, if there is excess amount of hydrogen available in the body, this excess amount of hydrogen will go and combine themselves with albumin. So this makes albumin to be less available for combining with calcium. So there will be decreased albumin calcium binding. There will be decreased albumin calcium binding. As a consequence, there is going to be more amount of free calcium available, and more free calcium available in the blood. This will lead to hypercalcemia, and hypercalcemia leads to, neuronal decreased excitation, and as a consequence, this will impair neuronal excitability, leading to confusion, stupor, coma. All right, Divya, can you able to understand this, doctor? Any acidosis, not only, respiratory, even if it is metabolic. You got it, Divya? Yeah. And Satyakumar, in alkaline urine, increased renal stone formation. So there can be hypocalcemia. Alkaline urine occurs in metabolic acidosis. Can this be a possibility? If the urine is alkaline, which means there is going to be more amount of bicarbonates, right? In this excess presence of bicarbonate, or whatever the reason for alkalinity, maybe lactate, citrate, whatever it is, this excess presence of bases in the urine facilitates crystallization of calcium. So this does not actually create hypocalcemia and cause renal calculi. It leads to crystallization, Satyakumar. All right. The tendency of calcium to get precipitated is more. That's the exact reason. Every alkalosis will tend to favor, renal calculi formation because of crystallization, not because of, blood calcium changes. You got this, Satyakumar? Which is why people who consume too much of vegetables, especially tomatoes and cabbages, they have more tendency of, calculi formation. Very good, good. So it's a very interesting question. I hope you have the clarity of pH connected to calcium, connected to albumin, how these three factors plays a role. pH, albumin, calcium. Guys, I hope you are clear with this. So yeah, that's a very important question. Okay, many of you have answered C, but okay, so Dr. Gunachitran, Dr. Monapriya, are you guys now clear, doctors? There is no confusion here, right? I hope this gives you the enough clarity. Yeah, perfect, perfect, people. So we have 3 more questions. That's all, 4 more questions. So a patient complains that she is not able to see to the right side through right eye and right side through left eye. Where could be the lesion? Ah, beautiful, beautiful, left optic tract. Good. So this is a contralateral homonymous hemianopia. Contralateral homonymous hemianopia. Lovely. Guys, why is this not option D? Why is this not option D? Option D, left visual cortex also will be bring about contralateral homonymous hemianopia, right? Why is this not option D? Ah, beautiful. Dr. Gunachitran, Dr. Shweta, very good, very good. Macular sparing. Very good, guys. Lovely. Beautiful, beautiful. Good. Stunning. A patient's ABG report reads this way. pH is 7.53, PCO2 is 20, and bicarbonate is 24. What is the condition? Quick. Beautiful, guys. Ah, lovely, Dr. Vinita. Okay, it's a case of alkalosis. There is a increased pH, decreased PCO2, so they are inversely related. And bicarbonate is normal. It's a case of respiratory alkalosis. Very good. Easy question. Good. A patient's liver biopsy report shows many eosinophilic bodies, which is positive for cytokeratin. The structure reports identifies as microfilament, microtubule, non-intermediate filament. Very good, very good. Intermediate filament. Lovely. Right answer. Microfilament is only one protein, which is nothing but actin. Microtubule is a protein which is made of tubulin. So this is neither actin nor tubulin. So this is neither microfilament nor microtubule, and hence it is intermediate filament. Intermediate filaments are nothing but desmin, keratin, vimentin, neurofilament. So these are all intermediate filament, guys. All right. So B is the right answer for this question because it is a cytokeratin. It is an intermediate filament. All right. Very good. A patient is diagnosed with MS. The cell that gets affected by antibodies is. Ah, beautiful. 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 Oligodendrocytes. Schwann cells are getting affected in Guillain-Barré syndrome. Guillain-Barré syndrome. So microglia, no way. Astrocytes, no way. B is the right answer, guys, and that completes our discussion. Now, people, if there is anything confusing or doubtful, please share your doubts. We'll discuss the topics. If you are clear, yeah, please go ahead and carry on with your studies. My sincere wishes and greetings for you people. And if you still have any doubts for any other question, please do text me or WhatsApp me. I'll clarify your doubts, people. Yeah. Thank you, doctors. Thank you very much. Thank you, doctors. Best wishes. Good luck. May God bless you all. Keep reading well. Thank you, doctors.